I've even had patients who have dropped hearing aids into a lake.
Oh, wow.
And gotten them out, turn them off or open the battery door, let them dry for at least 24 hours, put a new battery in or charge them up the next day, and they should work.
Can we bag of rice them? Can we throw them in a bag of rice?
I feel like that never worked.
Is it an old wives' tale? Because I still feel like that's still newish.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Ali Tressiter and Kevin Ziener.
Hello and welcome back to yet another episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Ali Tressiter.
And we are excited to be talking about hearing aid parts. This article comes from Dr. Emily McMahon from Alaska Hearing and Tinnitus Center all the way up there in Anchorage, Alaska. And those small hearing aids can be very complicated and intricate with their technology. And there is no one better to talk about that than our very own Dr. Ali Tressiter. So Dr. Ali, I know I have established that I know a lot of things about audiology and maybe some things about hearing aids, but I have no earthly idea how to clean them. So why don't you take this away?
Sure. So cleaning hearing aids is probably single-handedly the most important thing a patient can do to increase the longevity or the life of the hearing aid. So basic cleaning, probably the most important thing, is each night when you take them off, just brush over the microphones. Sometimes when you buy hearing aids, they come with like a little brush, but you can use that, or you can use even just like a microfiber cloth. Brush that off.
Just get the residue of the day off of them.
Exactly.
Okay.
Exactly. Because your ear creates oils and you sweat and all of that, and that does really kind of attach itself to the hearing aid. So you want to clean the body of the hearing aid, but you also want to clean the piece that goes in your ear. And again, you can use a microfiber cloth for that, whether it be a custom earpiece or whether it just be a dome.
And we're cautious when we do that, right? Because it could be a little sensitive depending on where you're rubbing.
Sure. And so you can actually, sometimes, especially if it's a dome, you can actually pop the dome off to clean it so you're not putting any pressure on that receiver. But generally, unless you're being really rough, you're going to be fine. A little tip that I have for cleaning the tips, is to really use microfiber. Don't use Kleenex. So if you ever like cleaned your glasses with a Kleenex and you see all the little lint bits, that exact same thing is going to happen to the hearing aid bits. Got it.
So there's the daily procedure of just get accustomed to cleaning them, maybe with something, a microfiber. Could you use like an alcohol swab? Would that be okay or no?
Do not use alcohol because it's super drying. So it can actually cause the case of the hearing aid to crack over time or make the earpiece become brittle.
Got it. And I know we've talked about this element before, but a wax guard. How, and I know this is subjective to the individual. Some people have more earwax than others, but typically when somebody has a new pair of hearing aids, how frequently should they be checking that wax guard?
So I'm going to say there is no typical length. And really, if you checked it, it's such a small piece. Unless it was really occluded with wax, it would be hard to determine if there was an issue. Typically, what I tell patients is if you are putting the hearing aids in, you know that they're on, they're charged, there's a fresh battery, and they sound dead or the sound is muffled, the very first thing to do is change the wax trap. Because it can go from just normal, beautiful sound to sounding completely dead with just a tiny bit of wax.
Got it. And one of the other things that I was told, and it makes all the sense in the world to me, but when I thought about it, I thought about the extremes, which is keeping your hearing aids dry. Because in my head, I'm like, well, no, I'm not going to go jump in a pool or jump in a lake with my hearing aids on. I'm going to try to avoid all rainstorms, right? But we still sweat.
Right.
And if you sweat maybe more than others, then being conscious of that is very important as a hearing aid user.
For sure. And really, I'm going to touch on like getting caught in a rainstorm. Generally, that's fine. I've even had patients who have dropped hearing aids into a lake and gotten them out. They're nano-coated, the inside pieces of the hearing aids, which means that they're water resistant. And so let's say you were in a huge rainstorm or you got in the shower with them on or you dropped them in the lake. Just take them out. turn them off or open the battery door, let them dry for at least 24 hours, put a new battery in or charge them up the next day, and they should work.
Can we bag of rice them? Can we throw them in a bag of rice?
I feel like that never worked, right?
So I listen, the only thing I know is I've dropped a cell phone in water once in my entire life.
Where was the water?
It was a pool. It was down at the community pool, actually. And I sped home, should have gotten 1,000 speeding tickets along the way, threw that thing in rice. Now, I left it in there for 24 hours, which was torture. I was able to turn it back on. The entirety of the phone was not normal, right?
Sure.
But it could get me to where I could download some of the properties that some of the apps and information off of the phone that I needed. But I just have this, is it an old wives' tale? Because I still feel like that's still newish.
I feel like it's been debunked.
Oh, okay.
I don't know if I'm making this up, but I would say, in general, don't put your hearing aids in rice.
Got it.
Rice has dust on it. There can be little pieces you don't want it getting into your hearing aids.
Yeah.
And also, I don't know that it works.
Got it. No, I mean, listen, I defer to the expert on this. My expertise, what comes from a guy who dropped his phone in the pool. So take that for what it's worth. One of the things about hearing aids too is they can be technologically updated, right? Like there is software in these hearing aids, and some people forget that, hey, if you've had them for a year or 2 years, they are due for a version of an update.
For sure. So in the same way that your phone will update operating systems, same thing with your hearing aids. Manufacturers are always releasing updates that either improve the hearing aids or fix a bug or something like that. And getting those updates, there's a couple different ways you can do them. Some hearing aid manufacturers will push the update to you right through the app.
Cool.
Other manufacturers require that you go to your audiologist to actually get the updates. So hopefully if you're already doing your quarterly check-ins with your audiologist, that's getting taken care of.
I know one thing, I was in a practice once, and a gentleman came in and he had said, I've only had these hearing aids for 2 days and they're dead, they're not working. And he had forgotten every night to take the batteries out. And because if you keep the batteries in, there's still some juice running to them, right? Sure. And so that's kind of trick number 1 or 1A is when they're not in use and you're definitely going to be asleep for anywhere between 6 to 10 hours, pop those suckers out and preserve the life of those batteries.
And generally, you don't even need to pop it out. If you have traditional zinc air batteries, if you just pop open the battery door, that's enough to turn the hearing aid off and it stops drawing power.
Got it. And then kind of the last thing is you need to go see your doctor of audiology. And how long how frequently should you be seeing your audiologist to just make sure that the normal wear and tear on that hearing aid is in fact normal wear and tear?
My recommendation truly is every quarter. I would go every 3 months really because that preventative maintenance is the best thing you can do to get longevity out of the device. Especially, I used to live on the East Coast and it is so humid on the East Coast. And those patients especially would come in once a quarter just because there's so much moisture in their air and sweat and things like that when you bring it into the audiologist, they can actually suck all of that moisture out of there and make sure it stays dry. It's
kind of like if you were to have your AirPods or have your iPhone, there are things you can do at home that they say, hey, you can clean out this little socket so that when you charge it, it's a perfect placement so that you're getting the full capability of it. But if you go past your own skill set of what they told you, the best thing you can do is go back to the Genius Bar and let the professionals handle it because they've been trained to do so. It's no different than going back to your audiology practice and saying, I've done all the steps. I'm now officially over my head. I have no idea what I'm doing. Can you do some maintenance on this bad boy?
That's a perfect analogy. And the one piece that I will leave everybody with is if you put the hearing aids in the morning, I'm going back to the wax traps and they're not turning on, they sound dead, you're not getting any amplification, always change the wax trap. Even if you don't think you should, or you just changed it, or you don't see any wax in there, again, 9 times out of 10, once the patient gets into the office, makes the trip, sits down for an appointment, it ends up being the wax trap. So number 1.
I have a question about the longevity of hearing aids. I mean, I know we're in these technologically advanced times and it feels like every year something new comes out. But what's like a normal range, an annual range for somebody to say, hey, I know it still feels new, but I might be due for an upgrade?
I usually say 3 to 4 years. So once the warranty is up of the hearing aid is usually when I start to say it might be time to think about upgrading, especially now. I would say in the last 5, 6, 7 years, the advances in technology have been so significant each generation to the next that a lot of times even 3-year-old hearing aids jumping up to the next generation can be a significant improvement in sound quality or processing. So 3 to 4 years, but definitely always keep an eye on your manufacturer's warranty, however long that is. And another piece of advice I have is when you're getting close to the end of that warranty, have your audiologist send those hearing aids into the manufacturer. They give it a once over. They make sure everything is working well because that's covered under your warranty. And then, once your warranty's up, you at least know you have functioning hearing aids.
That's some insider info right there, folks. Thanks again to Dr. McMahon for her article on hearing aid maintenance. And to learn more about this topic or any other audiology-specific content, please visit our website, askanaudiologist.com. Dr. Ellie, as always, it's been a pleasure.
Thanks, Kev.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
We have yet to find the first human species who has body parts that simply float.
Yeah,
But we'll get there.
So changing gears back to
Back to actual medical science? Sure.